The most important thing to consider when talking about airway is how you're sleeping. Some people have apnea in certain positions and not in others. Most people, when sleeping on their back, their apnea is going to be worse, and that's a product of gravity and soft tissue falling and closing that airway. Just simply by sleeping on your side or slightly elevated, you could improve your sleep apnea. As we gain weight, our soft tissue in our entire body, but including our mouth and neck, is going to expand. As that soft tissue gets larger and swollen, it's going to compress our airway and create a smaller airway that's more likely to close and cause an apnea event. Whether we're an adult or a child, when we sleep with our mouth open, that's going to bring our jaw back and create an even smaller airway. It's very important that we all sleep with our mouth closed at all times. If congestion's an issue, it's very important to have a nasal hygiene routine with some nasal sprays, nasal irrigations. I'm a big advocate of the new Wedge nasal irrigator because it's really easy and effective way to clean out your sinuses and your nose, as well as some over-the-counter sprays such as Flonase or X-Clear. Lip taping is kind of a funny fad that you'll hear about all over the internet, and it really does work. The reason why is because at night, we can't just tell ourselves to close our mouth. We physically have to make ourselves close our mouth, and the lip taping is just part of the training to get our body to close our mouth and breathe through our nose. Just having a little bit of resistance on our lips is enough to trigger our body to breathe through our nose. If our lips have a little more resistance than our nose, it's gonna help build that good habit of nasal breathing. But before you lip tape, you always want to make sure that you don't have an anatomical limitation or reason why you can't breathe through your nose. We always recommend lip taping during the day for at least an hour to make sure it's comfortable for you. If at any time you feel like you're uncomfortable, it's important to get an ENT to evaluate your nose and make sure that there's no anatomical barriers to that nasal breathing. Just learning how to breathe properly can decrease your apnea score. Working with a myofunctional therapist that helps with breathing and tongue position can decrease your apnea index by 50% alone. And of course, losing weight, which decreases the amount of soft tissue swelling that you have around your neck and your oral cavity, is going to significantly improve your airway condition and allow you to breathe better. Poor diets are also very pro-inflammatory. Inflammation is going to cause more nasal congestion, more sinus congestion, and you're going to have more breathing difficulties at night. Unfortunately, with the world that we live in now, allergies are very, very common. And if we don't eliminate that allergen, then no matter what we do, we're not going to be able to eliminate the congestion. It's really important to work with a doctor that's also going to be able to do some allergy testing for you and eliminate the cause of this inflammation. So when changing your habits alone isn't enough for you, we have a lot of different techniques that we can do. We have non-surgical techniques such as oral appliances and orthodontic treatment. And then for our most severe patients, we have CPAPs or jaw surgery that can actually physically open your airway so that you can breathe better at night. Our goal in treatment is always to start helping our patient as young as possible to try to prevent us from needing surgery later. When we're younger and still growing, we can use appliances and orthodontic treatment to develop those jaws and grow those bones the way they should. But once you're an adult and those jaw bones are done growing, sometimes we need to resort to surgery. Surgery can sound really scary, but there's a lot of great surgeons out there now that can treat sleep apnea and breathing issues quickly and efficiently and lead you to have a healthier life long term. So I do recommend surgery for those severe patients that really need it. Please follow me and watch more of my videos.